Hello, and welcome to your 2020 to 2021 Plan Year Open Enrollment period for Jacksonville Country Day School. Open enrollment this year will be from February 10th through February 19th. So let's see what's changing. This is our 18th annual ICUBA Open Enrollment, and we're happy to celebrate 18 years of service to private Florida education employees. Shown on the screen here are the logos of our 27 member institutions, and we're very happy that you're one of them. Here's a sneak peek of our review today. On the left column, you'll see what's new for April 2020. We're rolling out some new ICUBA group Aflac benefits, including critical illness, hospital indemnity, and accident. We also have some Rally program enhancements with the introduction of the physician results form. There's a small increase in the flexible spending limit. We're going to review dependent verification and also tell you about our sweepstakes this year for entering your phone number and email confirmation into the ICUBAbenefits.org website. On the right-hand side, we'll review a lot of the same great benefits that you have today and how they'll be continuing. So we'll review ways that ICUBA breaks down access to care and some of the plans that will just be moving forward with no changes. First up, the brand new benefit, ICUBA's newest brand partner, Group Aflac. The new group plans will include critical illness, hospital indemnity, low and high, and an accident plan. New group plans will provide better benefits at a lower cost in most cases. We are also offering guaranteed issue this year, meaning no medical questions will be asked. All prior individual plans will no longer be offered through payroll deduction. Portability information is available and has been mailed to you if you would like to retain your prior plan. The first Group Aflac plan that we'll review is our critical illness offering. The coverages included in this plan are listed in the left-hand column. So if you are diagnosed with one of these illnesses after April 1st and you do elect the critical illness coverage, the features of the benefit is it will pay a lump sum cash benefit to you upon diagnosis. This benefit pays in addition to other insurance coverage. It is guaranteed issue this year up to $30,000 for an employee, and the spouse is able to elect up to 50% of the employee election, up to $15,000 for the spouse. Children are automatically covered under the employee's election up to the age of 26. You may take all these coverages with you. All the Aflac plans do offer a portability clause. So if you should change jobs or retire, you can take any of the Aflac plans with you. We hope that you do not run into a critical illness diagnosis this year. And if that is the case, don't worry, you will still receive a small benefit from this policy. All you need to do is receive your annual health screening. With the annual health screening, a $50 benefit will apply. Next, we're going to talk about the Group Aflac Hospital Indemnity offering. This offering includes hospital admission or confinement due to an accident or illness, and also pays a lump sum cash benefit to you should you be admitted or confined to a hospital. This pays in addition to other insurance coverage, and it also includes portability. Premiums will be payroll deducted and no medical questions will be asked. We're offering two levels of the hospital indemnity coverage this year, a high plan and a low plan. The admission is the big difference in the two plans. Under the high plan, you'll be paid $1,000, and then under the low plan, you'll be paid $500. The confinement and intensive care is $100 per day under both plans. We've included an example for pregnancy or delivery here. This is one of the top reasons why people would choose a hospital indemnity plan, or if you have any other hospital admissions or confinements in your near future. Under the high plan for pregnancy and delivery, as you see, the admission is $1,000. Confined for 3 days for the delivery is $300. So the total payment under the high plan would be $1,300. On the other side, it shows an example of the low plan with the admission of $500, the same $300 for confinement, and a total of $800 for that benefit. We're also offering group Aflac accident insurance. So no one really knows when an accident is coming, but the big question is, can your finances handle it? It's reassuring to know that accident insurance plan is there for you in your time of need to cover expenses like ambulance rides, emergency room visits, for fractures, burns, lacerations, concussions, all of these accident-related items. Again, we hope that you do not need to cash in on an accident this coming year. And this policy also has that $50 annual health screening benefit available. The new BlueRewards powered by Rally program this year got a tiny bit of a facelift. The wellness exams and biometric screenings both increased. The wellness exam this year will be worth $60, and the biometric screening this year will be worth $40. We've also increased the number of on-site campus events, and you have the ability to earn $10 a piece up to a total of $70. It's important to note that the Rally survey is still the gatekeeper. So after April 1st, it's important that you log in, complete that Rally survey, so you can start earning those gift card incentives. Preventive exams are still in the running. It will be $50 still for a PSA, a colonoscopy, or mammogram, and this will be rewarded for the very first claim that's processed. Also, if you qualify for a medication change through ICUBA Cares, there is a $50 incentive attached to that. We're also still doing coins for missions, challenges, teledoc registration, tobacco attestation, and clinical rewards. If you notice, the missions and the challenges and the survey also have private sweepstakes tied to them. Many people ask, what are the coins good for? What can I do with them? We want you to pay close attention to your email because they run flash sales every now and then, generally around once a month. And you can get really good discounts on movie tickets and theme park tickets and other health-related items. Just a fun feel-good fact for you is ICUBA members are very generous. We donated more than 4 million coins to charity last year. So congratulations on a job well done. We're excited to introduce a physician's results form this year. I've been asked several times when I'm on campus, well, I just got my blood work done, can't I just submit it? Well, in the past, that answer has been no. But starting in April, ICUBA members can get credit for biometric screenings by visiting your own physician. You'll log into the same portal where you've set up your on-site screening in the past, so you'll log into Quest, and there will be a new option for you where it says physician results form next to number 1. Step 2 is that you'll download this form. It will be a unique form just for you. It does contain a barcode that was specific for the employee or a covered spouse. So make sure you don't copy this form or share it with your friends. It is for you only. Step 3 is completing your annual wellness exam, including blood work with your doctor. The doctor will fill out the spot that's circled on the form in red next to number 3. So getting the biometric information onto the form is really important. The final step is submitting the form. The physician can fax the form to Quest Diagnostics directly, and the number is listed at the top of the form. We are encouraging all members to request a copy of the signed form from your doctor's office. So in case the doctor's office misplaces the form or doesn't remember to fax it in, you can take matters into your own hands and fax it in or upload it to the portal on your own. A few Rally reminders. Rally Clinical Rewards for chronic conditions is still available. If you've been diagnosed with one of the conditions listed on the left-hand side of the screen, your Rally screen might just look a little bit different, and it will just providing some educational materials to you. If you participate in the educational events, such as reading articles or contacting a health coach, Rally will reward you with an additional coins each quarter and up to $2,000 or 2,000 Rally coins each year. On the opposite side of the screen, the city challenges and private sweepstakes. Are you ready to win? ICUBA is giving away $50 Amazon gift cards every 2 weeks. All you need to do is enter into the city challenges, and every time you cross a milestone within the city challenge, you'll be entered. We again are giving away, we're drawing a prize every 14 days for those city challenges. The other private sweepstakes that I mentioned on the prior slide include surveys, missions, and the other challenges. So we will be drawing those out of the ICUBA office as well. There's a new flexible spending election that's required each year for both healthcare flexible spending and dependent care flexible spending. Both of these two accounts listed on the left-hand side of the screen are funded by the employees. They are both funded through pre-tax dollars throughout the year. The healthcare flexible spending is available for immediate use on April 1st, 2020. The healthcare can be used for eligible healthcare expenses for you and any eligible tax dependent. If you're enrolled in an ICUBA plan, the healthcare flexible spending account funds will be used before your employer-sponsored HRA funds. The new IRS annual limit went up $50 this year, so you can contribute pre-tax $2,750. The dependent care flexible spending is slightly different. It will be deposited for use as you contribute it through your paycheck. This account can be used for dependents under the age of 13 and can be used to cover for expenses like daycare, aftercare, summer camp, gap camp, any type of daycare related item. The IRS annual household limit is $5,000. Both of these accounts are subject to the use it or lose it rule. There's no annual carryover, so please plan wisely with the healthcare and dependent care flexible spending account. On the right-hand side of the screen, just a reminder that Jacksonville Country Day School does still contribute to an HRA for you. This account is fully funded by the employer, and Jacksonville Country Day School is also very generous in the fact that they pre-fund this in April. This account will earn interest quarterly and can also be used for eligible healthcare expenses for participants enrolled in an ICUBA medical plan. These funds roll over every year, and after 36 continuous months of enrollment in an ICUBA medical plan with the HRA attached, you're considered what's vested, and these funds are yours to keep if you should ever leave. Dependent verification is still part of our process at open enrollment. Dependents that are not eligible on the ICUBA plan should be removed during open enrollment, and their coverage will terminate as of March 31st. Just in case you missed this paragraph before you click the final I agree button, this paragraph is you certifying that all the dependents for which you've made elections for are in fact your eligible dependents. So who is an eligible dependent? The items listed, the bullets listed on the screen here represent what is considered an eligible dependent under the ICUBA medical plan. We just want to note for you, a child is still considered a dependent until the end of the calendar year in which they turn age 26. If you have a dependent that's over the age of 26 and they are considered continuously incapable of self-support, and you have documentation of their disability, they may be able to continue under the plan when you submit proof. So you'll visit ICUBAbenefits.org to make all of your elections. This is open enrollment, as you know, and during the open enrollment period, you're free to update your benefits for the April 1st, 2020 to March 31st, 2021 plan year. You will not be able to make any other changes unless you experience a qualified life event. And with one of those, you're eligible to make changes within 30 days of such event. So go ahead and log in at ICUBAbenefits.org. There will be a enrollment bar at the very top of your screen. Click the Start Your Enrollment button, and then you'll just step through the process, verifying following the roadmap along the way. Once you complete your enrollment or each section, you just click the orange Continue button. At the end, you'll be able to view, email, or print your enrollment once it's complete. If you turn Emma off in the beginning, like most people do, don't worry. If you need her help, you can always turn her back on. Open enrollment sweepstakes, everyone's favorite. You just have to log in at ICUBAbenefits.org and make sure that you confirm your personal phone number and personal email address. Once you finalize your enrollment process, you'll be automatically entered to win. But the phone number and the email address are the two main items for the sweepstakes. Just a reminder about ICUBAbenefits.org single sign-on section. This is one of the ways that ICUBA breaks down those barriers to care. So if you are enrolled in the medical plan, you will see the MasterCard link, the OptumRx link, the Blue Cross Blue Shield link, Aetna, and then also IMED and Humana are also available. If you've never visited these sites before, you may be asked to set up a username and password for your first visit, but after that, you can log directly in. This slide breaks down some of the plan features. In the far left column, all these items should always be $0 to you as the member. This is what we call no-cost access. Items like Blue Distinction Total Care primary care visits, mammograms, colonoscopies, medically necessary labs performed at Quest Diagnostics. These are some examples of items that should never cost you a penny. In the middle, we have no deductible items. So these items in the middle section will most likely be tied to a coinsurance or a copay, but should never be tied to that higher deductible amount. Items like advanced imaging, convenient care, emergency room, office visits, physicals, prescription drugs, therapy, and urgent care. All of these are never subject to the deductible. In the right-hand column, these are our more major services, and for major services, the deductible will always apply. Items like durable medical equipment, any sort of hospital stay, inpatient rehabilitation, private duty nursing, and some of these other items on the right will always require the deductible first. Just a reminder that Surgery Plus is paired with your medical plan. So when you elect the Blue Cross Blue Shield's ICUBA medical plan, Surgery Plus just comes along for the ride. Surgery Plus provides us the surgeon quality with their Surgeons of Excellence network. Their surgeons are licensed, board certified, fellowship trained, and they have been screened for malpractice, sanctions, and criminal records. They cover hundreds of medically necessary surgeries. Some of the extremities that are included are located on the bottom left-hand corner of your screen. If you need a non-emergent but medically necessary surgery and you decide to use the Surgery Plus benefit, there is a financial incentive included. Your deductible and coinsurance will be waived, so the procedure is at no cost to you. If Surgery Plus asks that you travel for your surgery, a travel benefit is also included. Contact a care advocate today for more information. The number is shown here. This full concierge service can locate the best surgeons for your request. Once you select a surgeon that meets your needs, then the care advocate will take it from there and schedule all appointments for you and coordinate medical transfers and then follow up as necessary. Teladoc is still a benefit, still a fan favorite as well, just for a $5 copay. This is a telemedicine or video consultation available anytime, 24 hours a day, 7 days a week. So if your doctor is unavailable, you're stuck at work, you just don't have time, you're on vacation or a business trip, any of these times are really great opportunities to contact Teladoc if you're feeling under the weather. Top diagnoses for Teladoc are listed on the bottom left-hand corner of your screen. So these are more minor instances like a sinus infection or pink eye, the flu, if you have a cough, or just nasal congestion. Teladoc is able to prescribe you a prescription so you can start feeling better and get on your way. Just keep in mind, they're not allowed to prescribe controlled substances, psychiatric, or lifestyle drugs. So just make sure that you're calling for a more minor situation as included on the screen. Just a reminder about ICUBA Care's Pharmacist Advocate Program. You might be wondering, why would I ever call them? Well, do you have any side effects from a new medication? Or your doctor started you on a new medication and you just have questions about it? Or were you denied at the pharmacy for a prior authorization and you misplaced your letter from Optum? Or were you told that you needed to try step therapy before you can take a certain drug? Or are you just like me and you want to learn how you can save money by switching to a generic? These are all great reasons to call ICUBA Cares. ICUBA Cares is available Monday through Friday during normal business hours. They're real pharmacists and they really advocate for you and they provide real solutions. Condition management is also a really special benefit that's pretty underutilized from our standpoint. The Able To program really tackles the health and life challenges that are listed on the left-hand side of the screen. So if you have any of these health or life conditions, we encourage you to call Aetna and find out more about the Able To program. This program brings together a meeting with a therapist once a week and a behavior coach, once a week, over a total of 8 weeks, totaling 16 sessions. Through these sessions, your therapist and behavior coach can help address emotional challenges and identify health goals to help you develop an action plan. The lessons that you learn over these 8 weeks will not only help you better control your health or life condition, they will help you throughout the span of your life as well. These are behavior changing goals that you will really use for the rest of your life. Health management and care consultants are also available through ICUBA. ICUBA has partnered with Blue Cross Blue Shield, Optum, ICUBA Cares, and Aetna to contact you because we care. These are trained healthcare advisors and registered nurses calling to provide you with tools, education, and advocacy. They're calling to help you manage a chronic health condition that you've been identified with. They're just calling to help you better understand your doctor's treatment plan and help you set some goals and really just support you through that chronic condition process. We know it can be overwhelming, so we're here to help. Please, if somebody calls you from one of these brand partners, give them 5 minutes of your time and see what they have to say. Just a reminder, all primary care Blue Distinction Total Care visits are always free. Medically necessary services provided at family practice, internal medicine, or pediatrician will not cost you $1. So if you're in the market for a new primary care physician, make sure they meet the qualifications and fall under the Blue Distinction Total Care umbrella. Care Connected is still in your corner also. Care Connected is a fancy way of saying Blue Cross Blue Shield customer service. They can help you with claims questions, concierge assistance for billing. They can even assist you with finding one of those fancy Blue Distinction Total Care providers we were just chatting about. If you are interested in lifestyle coaching or chronic condition coaching, they can also help you with that. The number can be found on the back of your Blue Cross Blue Shield ID card next to customer service. Just a reminder, the My Health Toolkit is still available. We introduced this new app last year at open enrollment, and we are blown away with its features. One of my favorite features is I can save my ID card to the home page so I can look at my ID card without even having to log into the app. If I do need to log in, it's very easy through Touch ID or facial recognition. Once I'm in the app, I can view my benefits, view my ID card, and check out my claims. One of my favorite things is that I can easily pull up my explanation of benefits directly from my phone. I no longer have to log on to a computer to see what the portion is that I am responsible for paying. The Employee Assistance Program is still here to help everybody at Jacksonville Country Day School. You do not need to be benefits eligible, and you do not need to be enrolled in the ICUBA plan. The EAP is for everybody, just by being employed by Jacksonville Country Day. The 4 categories on the screen are the things that people call the Resources for Living helpline most often. Starting on the left with the emotional support, we have up to 6 sessions per issue per year for each member at Jacksonville Country Day and each member of your household. So this is an expert point of view over the phone, televideo, or in the office. And again, it is 6 sessions per issue per year for free. They also help tackle life, legal, and financial. Do you need somebody to mow your lawn? Well, you're in luck. Under the life category, it's pretty much like a personal assistant. They can just obtain referrals for your services needed by you or your dependents. The legal portfolio provides a wide array of legal needs, including legal documents like a living will and several other items. The financial is also really important, especially considering that tax season is coming up. So if you have any financial questions or you want to speak with a financial consultant, there's another good reason to call Resources for Living. We've included the number here on the screen, and it's just option 1 for the EAP. And just a reminder, all calls are free and confidential. The EAP also went digital last year. So just a reminder, TalkSpace is also available so you can text the therapist. Step 1 in setting this up is you must call Resources for Living for authorization. But from there, they can walk you through the whole process. In order to text a therapist, you must be 18 years or older. We offer several mobile apps to help you break down barriers to care as well. I personally have an ICUBA app on my folder, or an ICUBA folder on my phone that contains all of these apps in one central spot. The username and password that you log in with the first time that you log in through single sign-on is the same username and password that you will use to get into many of these apps. Great news. The brand partners that you see on the screen here are not changing for the coming plan year. Jacksonville Country Day School will still offer 2 medical plans, the Preferred PPO and the 4,000, 8,000 plan. Again, these plans are not changing for the coming year. The 4,000, 8,000 deductible PPO plan, we just wanted to review really quickly with you that this plan was designed for for families with healthy children. This plan provides a premium cost savings. It also provides freedom to choose a plan that meets your needs as a family. If you're willing to shop for prices for service, and if you'd like to visit providers of your choice. The 4,000, 8,000 deductible PPO plan will have a 0% increase for children and family tiers of coverage this year. So if you're looking to save some money, this might be a great plan for you. We ask that you make yourself familiar with the differences of this plan offering. The deductible and out-of-pocket are significantly higher than the preferred PPO. The coinsurance and copays are higher. And while the plan premiums are much less, and you might save money each paycheck, if you have or experience a catastrophic event this year, this might end up costing you more. Both of our plans contain the same great core benefits that do not apply to the deductible, same well-being incentives through Rally, and same prescription drug benefits. The prescription drug plan is going to remain the exact same. There's still a a 30-day at retail only, or a 90-day supply at retail or mail order. Just a reminder, the 90-day supply will save you money. So if your prescription is eligible for that 90-day supply, we really encourage it. Prescription drug freebies are also not changing this year. So if you have a prescription from your doctor for diabetic supplies, aspirin for adults, folic acid, or prenatal vitamins, these are a few of the items that you can get for free under our drug plan. We do have a separate prescription out-of-pocket maximum. This separate out-of-pocket maximum is meant to protect you if you are not somebody that visits the doctor very frequently. However, you are on a lot of medication. This is just an added security blanket. The behavioral health and substance abuse benefits are also unchanged this year. They will remain under the Aetna brand partner. If you are in need of professional counseling, psychiatric medication evaluations, applied behavioral analysis therapy, including autism, or intensive services, these are all still with the Aetna brand partner. It is the same number as the EAP, so if you utilize the counseling services under the EAP, they can be easily rolled into your behavioral health benefit if you decide to continue services. So same phone number, option 1 is EAP, option 2 is behavioral health. The Humana Dental plans are not changing. We're still offering a high PPO and the DHMO prepaid plan. The high option PPO has a plan year maximum of $2,000 and then also includes a $50 individual deductible and a $150 family deductible. It includes preventive, basic, major services, as well as orthodontics. The DHMO plan covers most of the same things as well. The one thing I will note for you is the DHMO plan follows the schedule of benefits, so everything does have a preset copay for which you'll pay a fee for your services rendered. This plan also requires a network provider be assigned in advance of your dental visit. So when you're stepping through the process at ICUBAbenefits.org, if you've not already pre-selected a dentist, make sure that you do that. Your dentist must be in the state of Florida as well. The vision plans are not changing. We still have the base plan and the buyout plan. The base plan covers frames every 24 months with a $100 allowance for frames and contact lenses. On the right side of the screen, this is the buyout plan. The buyout plan covers frames every 12 months with a $130 allowance for frames and contact lenses. Income protection benefits are also provided by Jacksonville Country Day School for all benefit eligible employees. Income protection benefits include basic life, basic accidental death and dismemberment, and long-term disability. Just some open enrollment housekeeping. We want to close everything out by reminding you that changes made during open enrollment will remain in place for the full plan year, which begins on April 1st and ends on March 31st, 2021. Changes made outside of open enrollment period are only permitted within 30 days of a qualified life event. Life events include a birth of a baby, a marriage, or a gain or loss of other coverage, just to name a few. So just if you do encounter one of these events, make sure you contact HR within 30 days. The 1095 tax form is not required this year. We are going to house it for you safely in your employee file at ICUBAbenefits.org. All other requirements of healthcare reform are in place. And just a reminder, ICUBA plans offer more generous free wellness benefits that are required by law. When you're in there updating all of your other benefits and making sure that things are as you wish, it's also time to review your life insurance beneficiary information. Just important to note, when designating a beneficiary under the age of 18, you may want to contact an estate planner or establish a proxy for such dependent. Thank you very much for your attention. We hope you found this webinar very helpful. We're really excited about our 18th year of continued service to our 27 employer members. Have a great day.